Call it Pop Bubba Sparks.
Booty, 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 rockin' everywhere. Booty, booty.
Hey, I don't know what to do. I don't know what to do.
What's up YouTube, it's Desi and I'm back with another video, you guys. It's going to be day 9 for the Vlogmas, and don't forget it's 16 more days till Christmas, y'all stay tuned. Alright, so YouTube, in this video I'm going to talk about as far as for what's the difference between CMA/MA, CNA, and also PCT, and that's going to be for Certified Patient Care Technician. So y'all make sure y'all get ready for this video. I hope y'all digging my hat, you guys. You know Christmas is coming. It's a couple more days left until Christmas and I got to get into the spirit for it. All right, so y'all, so let's talk about the requirements first. Now, the requirements as far as for a CNA, the requirements is basically for you to be certified. Really, all of them you have to technically be certified. You can either be certified, have a license, you either get a certification. That'll be basically the certification that you'll get whenever to perform any one of these tasks. So the requirements is pretty much self-explanatory. Yes, you do have to go to school or technically complete a course to kind of know a knowledge about each one of the jobs. Let's get into the job tasks. So as far as for the job tasks, CNAs are most likely clinical. With CNAs, basically CNA stands for Certified Nursing Assistant, and the duties that they are limited to will be assist with daily activities of the living. So basically helping out with bathing, dressing, eating, all those type of things. Majority of the time they're going to monitor and record and report changes in the patient's health. So majority of the time they may either watch you while you're sleeping, or they may either watch you as far as for making sure you eat all the correct type of food. If you wake up in the middle of the night or something like that, they'll have to document that down for the nurse. Also maintain a clean patient environment and provide comfort to the patient. So CNA is basically a good job. You're always going to be bedside when it comes to the patient. All right, now as far as for patient care technician, the tasks are similar to CNA, but however it includes a higher level of responsibility. So technically the task for the patient care technician will be something as far as for performing EKGs. Technically deals with heart flow. So anything dealing with the heart flow, that's basically what they'll be doing as far as for that. For medical assistant school, we were able to practice EKGs. We were able to pull one of the students from another course. So if you were in dental assisting or if you were in medical billing and coding, we will bring you to the clinical setting area and just lay you on the table, make sure that we put the correct cords on for you, take your EKG, it'll print out a reading of it, and that's how we kind of like learned. We were able to get a little bit more in depth to understand as far as for V1 through V6, the placements of the rods and everything like that. So it was a pretty cool experience. So EKG, performing that, I definitely would feel like that's good. Patient care technician, there's so many jobs as far as for all type of hospitals. If you guys check any hospital that you're located near, definitely check for career jobs. They have plenty of jobs as far as for patient care technician. Also, they perform a lot of phlebotomy procedures as well too, so that can be a good experience as well. Now as far as for a medical assistant, they can do both clinical and administrative. I always mention this every time with any of my videos when I talk about medical assisting. So let's get right into it. So basically with medical assisting, they are the most versatile when it comes to the healthcare field. Thank you. But I'm not gonna lie, we do a lot, you guys. We do a lot. Like for half of the time, most of the time, people, if you're a medical assistant, most of the time people will think that you're a nurse. Half of the time, like if you're working like a private owned setting, like most of the time they'll be like, yeah, I've spoken with your nurse or something like that. But of course if you're working at the hospital setting, they're gonna be like, they know that you're a medical assistant. And even with the badges, though it says medical assistant on here, half of the time, I'm telling you, they treat you like you're a nurse. All right, so basically the duties for the medical assistant is to check in and check out the patients depending on the arrival. It'll automatically pop up on RE Clinical's EMR, so you know that's not nothing too bad that you got to put in. Answer phone calls and questions. We do that on a non-stop daily basis. Perform basic billing and coding procedures. I also have to use that whenever doing prior authorizations for cover my meds to help get the medication approved for the patient. So knowing ICD-9 and 10 codes are definitely important. Assist with providers with exam and procedures. I love doing that. Assist with minor surgeries. I love doing that. Administrator injections or medications. Also perform EKG, phlebotomy, and laboratory procedures. Make sure you take patients' vitals and help patients stay up to date with any type of testing that they have done, and make sure that you perform health coaching or educate the patient. It's hard to pretty much outline a typical day for a medical assistant because the job title and responsibilities varies each day and is different. So you know, it's so many things that can be done as far as for that. Now let's talk about who works with who. So CNAs work with nurses. CNAs are basically, can also be known as nursing aides, and they basically work underneath a RN or LPN. All right. Patient care technicians usually work underneath the supervision of a nurse, but sometimes work underneath a supervision as far as for a provider such as a physician. They often work in hospitals, but sometimes work in extended care facilities such as nursing homes. So like I said, they majority work in the hospitals. Medical assistants work for a variety of providers. Medical assistants can either include working with physicians, nurse practitioners, physician assistants. They can also typically work as far as for medical office, clinics, hospitals. Everything varies as far as for that as well too. One thing about medical assistant is growing and changing so much, just as much as CNAs. So it's kind of like we bumper to bumper. Let's talk about pay, because everybody loves to talk about pay. All right, so according to this, it says on here that CNAs require less training, but typically earn less than a patient care technician or MA. It says on here that the average range as far as for a CNA would be $13 an hour, and that's definitely true. I'm not gonna lie, you guys. With CNA, you can get into the field faster because the courses are a lot more easier to kind of catch on. Like you could technically take a CNA course that's like 4 months and you get hired on like that, but they make at least average like minimum wage. So I wouldn't doubt anybody as far as for CNA, but just to let you know as far as for what you're getting yourself into. As far as for patient care technicians, they typically have higher salaries than CNAs, but however they make less than medical assistants. Usually patient care technicians make at least around like $13 to $15 an hour. It all depends, and it also depends as far as for the hospital training programs that you continue to go to as well. Some programs are different. Some can take longer to get done, some can take shorter to get done. So it all just depends. Hospital training programs usually range between 2 to 3 months, whereas if you were to go to a community college or something like that to complete the program, it usually takes between 7 months to 2 years. MAs get paid more than CNAs and patient care technicians, and they are in high demand. It says on average on here, medical assistants usually make at least $15 to $18 an hour. It also depends on the state. And I always mention that in my videos, it always depends on the state, because some people be so quick to comment down below and be like, hey, I live in California and I make this amount of money as a medical assistant. And I'm like, you're way on the other side of the coast. Like, you know what I'm saying? It all just depends on the location that you're at. Medical assistant programs usually take up to 1 to 2 years to complete, but it also depends if you're trying to complete as far as for associate's degree, and you do get more money when you do that. So for the most part, that's the difference between a medical assistant, CNA, and patient care tech. I definitely feel like if you haven't had the experience as far as for medical assistant or CNA, try to go for patient care tech. They may be able to teach you everything with getting learned on, getting hired on and everything like that, so it shouldn't be as bad. This is just one of the jobs that I figured I would share with you guys to kind of expand your horizon when it comes to healthcare jobs. So hopefully this be able to help you guys out. Don't forget to like, comment, and subscribe, and y'all make sure y'all stay safe. Peace.